section on public health for behavioral science and psychiatry for Falcon Physician Reviews. What are the causes of death? The leading causes of death in the United States overall are number 1, cardiac disease, number 2, cancer, number 3, cerebrovascular accidents or strokes, 4, COPD, and 5, accidents. So this is, on your exam, if they say leading cause of death and they don't give you a particular age group, these are the ones that you're going to answer. But if they give you a particular age group, then in the next couple of slides we'll go over those factors. So the causes of death in men are cardiac disease, malignant neoplasm, and accidents. And in females are cardiac disease, cancer, and stroke. So as you can see, the first two causes are the same in both male and female. The only difference is that men have accidents, which is number 3, and for female they have strokes. Men and women have a combined cancer death of lung cancer, which is the most common cause of death with the two groups combined. And in infants, the most common cause of death is congenital anomalies, followed by low birth weight or prematurity and SIDS. In children ages 1 to 4, accidents. They're young, they will run into things, they're just learning to move around, they don't know what's really right or wrong, so accidents will be the common cause, followed by congenital anomalies and then cancer. Again, as you can see, from the ages of very young to the adolescents, accidents is the number 1 cause of death. Because of impulsivity, in adolescents, remember, they take high risk-taking behaviors, and when they're younger, it's because they don't know any better. So accidents in the younger ages is the number 1 cause of death to remember. Then you will followed by cancer and congenital anomalies in the ages of 4 to 9, and then from 10 to 14, suicide starts to emerge as the third leading cause of death, and suicide continues on until the age of 24 as the third leading cause of death. But you must remember, in the ages of 15 to 24, this is pretty high yield for the USMLE. Accidents are number 1, followed by homicides, followed by suicides. But in this age group, from 15 to 24, homicides in African American males is the number 1 cause of death, and that's very high yield for the USMLEs. Again, 25 to 34, here we see again accidents. Suicide is number 2, followed by homicide, number 3. 35 to 44, cancer is reemerging again, followed by accidents. Cardiac disease, again, 45 to 54 is very similar, but cardiac disease and accidents switch places, but cancers are a big problem here. And as you get older, then you get older than 65, cardiac disease becomes number 1, followed by the cancer and cerebrovascular disease, which is your stroke. So again, this is going to be something very difficult to memorize. Try to make some sense out of it. Children that are very young are very accident prone. Adolescents are very impulsive. Think about the 15 to 24-year-old kids that are getting into gangs and violence. So homicide is the number 2 reason to die, but in African Americans it's number 1. Young adults usually die of random tumor that they usually get. Usually someone in their 30s and 40s won't die of a heart attack. So that'd be a way to remember that cancer would be a reason. Something very unsuspecting, something that you wouldn't expect would be a tumor or an accident. And then as you're getting older, remember that heart disease and strokes and cancers, again, are major problems. So if you can kind of think of it that way, it might be easier for you to remember than to just sit here and look at it over and over again and try to memorize it. So the leading sites of cancer, this is another high yield question. In men, prostate is the most likely to occur, followed by lung, followed by colorectal cancer. And for cancer death in men, even though you get more prostate cancer, more men are going to die of lung cancer, followed by prostate, followed by colorectal. And in females, they have a higher incidence of breast, followed by lung, followed by colorectal, but more females die of lung cancer, followed by breast cancer and colorectal. So if you remember, we said that the combined cancer death was caused by lung cancer. So we'll talk a little bit about family and divorce. United States has the highest divorce rate in the world. In the 1960s, there were about 26 divorces per 100 marriages. But in the 1990s, there were almost 70 divorces per 100 marriages. That's a huge number. And most divorces are generally around the 4th year of marriage, and that's generally when people are starting to have children, financial problems. This is when all this kicks in, and where divorces take place. So who has higher rates of divorce? Children who have had divorced parents. And this they can see because if your parents have divorced, it's a kind of a mirroring. Oh, well, my parents got divorced. That was the way that they saw how to get out of their marriage. That may be an option for them instead of seeking other ways of getting help, such as therapy. People who get married when they're very young, and why that is a problem is because when you're very young, you're still forming your ideals, you're still figuring out who you are, and as you get older, you might change, and you might have really married someone who you aren't going to get along well with. People of lower socioeconomic status, and also people with very high socioeconomic status. I know that Us Weekly stays in business because it's commonly reporting about how Britney Spears and Paris Hilton are frequently breaking up with their boyfriends. So those are some examples. Children of divorced parents have more problems, more behavioral problems, they have physical problems, and they don't adjust very well. Depending on when parents divorce, sometimes children will feel like the divorce is their fault. So it's a very difficult time for children who have divorced parents. And divorced people in general have more medical problems, more mental health problems such as depression and anxiety, and divorce is the second only to death of spouse in terms of psychosocial stress. So it's a pretty severe stress for someone to get a divorce. And why is there an increased divorce rate in the United States? Well, one, women are getting more and more educated. They're working, they're getting into just as good jobs as the men, so they don't have to financially depend on the men. There's fewer family supports, they're distant from their family, so they don't have the extra support that they need if the husband and wife are not getting along together. It's easier to get divorced. It's very easy and quick to get divorce papers and sign them and be over with it. And also there's less social and religious restrictions. But what about successful marriages? What makes them different? Well, usually successful marriages, these couples have the same backgrounds, they may have come from the same town, they're about the same religion, they're the same race, usually about equal intelligence, equal amount of education usually helps, and there's highest levels of marital satisfaction among partners without children. So children actually tend to be a very big stress in marriage because one parent might want to parent them one way, another parent might want to parent them another way. Also, when women have children, much of their attention might get focused towards the children and diverted away from their husband. So there are multiple reasons why children can cause some marital problems. Next, we'll go on to talking about suicide. So there are about 30,000 completed suicides per year in the United States and over 600,000 attempts per year. And women actually attempt suicide 3 times more commonly than men do, but the men are the ones that actually complete 4 times as much as women. And about 66% of suicides are committed by white males, and so white males is a very big risk factor for suicide. And why do men actually complete suicide more than women? It's because they use more lethal methods of suicide, such as firearms, meaning guns, whereas women usually generally use overdose on sleeping pills or their prescription depression pills, which usually won't kill you. And frequently when women are trying to commit suicide, it's usually an attention-seeking kind of behavior. Not that men don't do that, but the reason is that men usually have more lethal behaviors that can kill themselves. So what are suicide risk factors? On your exam, the number 1 risk factor is going to be a previous attempt. That's the most important. Now, another way to remember all these suicide risk factors is to think of a scenario of a man. So what I want you to think about is an old white male who lives by himself, and he's debilitated, he's got multiple medical problems, He's on disability, so he can hardly pay his rent, and he's all by himself. So this is, if you can think of this, an old white man all by himself, no friends, no family, alone, poor, those are going to be your biggest risk of suicide. Also, religion can be somewhat protective. Catholics believe that if you kill yourself, you go to hell, usually very protective for them, whereas if you're Jewish and Protestant, if you don't have those same beliefs, then you might be at an increased risk of suicide. Clinical risk factors, patients usually who commit suicide have had some sort of mood disorder, such as depression or bipolar. Schizophrenia has a high risk of suicide, as well as substance abuse. Remember, in adolescent boys who are using substances, they're very impulsive, doing highly risk-taking behaviors, don't know how to control themselves, will accidentally kill themselves. Also, within the first week of discharge from a psychiatric hospital, patients are 30 more times likely of committing suicide. And the reason for this is because you've taken them from their stressful situation, put them in a hospital where the stress has been removed, they're doing better, but when they get back home, the stress returns and they don't know how to deal with it, and they will frequently hurt themselves. Firearms are the most frequent used methods by both male and females to complete suicide, even in adolescence. So on your exam, if they ask what is the most common way to complete suicide in adults, in females, males, adolescents, it's always going to be firearms. And women are more likely to overdose in an attempted suicide. 60% of teens state that they know someone who has committed suicide, and the Native American teens have the highest suicide rate among all ethnic groups. And the highest risk among adolescents who committed suicide were between the ages of 15 and 19 and who are depressed and used alcohol. So again, mood disorders here, depression, big deal, and so is alcohol or drugs are a big deal when it comes to committing suicide. Elderly suicide. About 25% of suicide victims are the age of 65. So in our vignette, when we were thinking about suicide risk factors, we were thinking of an elderly white male living by himself who was ill, drinking his alcohol, was the one that was going to kill himself. And the suicide rate for elderly men is actually 3 to 4 times that of the rest of the population. So it is very significant, should be taken very, very seriously. So why would the elderly kill themselves more? Well, if you think of Erikson's stages, integrity versus despair, the very last one. This is a period of time when people are starting to lose their family, lose their spouses, lose their friends. Did I achieve enough in life? I'm going to die anyways. I don't have anyone. They become very hopeless. They become very lonely, and hence they might kill themselves. So let's talk a little bit about how healthcare is in the United States. It has changed in the last 40 years, especially with HMOs coming into the picture and the change of insurance. And also, because we have so many more advancements in our medical field, patients with chronic conditions are living longer and utilizing more resources. So white patients see physicians 10 times more often than African American patients do. And African Americans have highest infant mortality rate, and it might be due to low birth weight or infant pulmonary distress or any kind of infection. But the highest amount of SIDS is found in Native American infants. People who are 65 and older, I guess you guys have heard about the baby booming age. So in estimate of 2030, there'll be 22% of our population will be 65 and older. Currently, it's about 17%, and in the 1960s, about 4%. So you can see the huge increase in the elderly population, not only because there's an increased population, but because we have more medical technologies that will cause people to live longer. And elderly account for 33% of healthcare costs. So it's a pretty big number. A third of healthcare costs is from the elderly. And this is a short break from public health for behavioral science and psychiatry for Falcon.